So we're going to be talking about ocular pharyngeal muscular dystrophy, which is OPMD. It is ocular because it looks like a chronic and progressive external ophthalmoplegia with ptosis. And that's because it's a muscular dystrophy and it can affect the extraocular muscles and the levator. And it's pharyngeal, and that's the part that's actually dangerous, not the ocular part, but the pharyngeal part, because that can lead to aspiration, swallowing difficulties, and it can affect other muscle systems. So it's not really just an oculopharyngeal muscular dystrophy. It can make you weak and you could end up in the wheelchair. And in addition to the ocular findings, painless progressive ptosis with or without ophthalmoplegia, with or without diplopia, and the pharyngeal findings, you got to worry about complications related to surgery and anesthetic agents because they might not be able to be weaned because they're weak. And so we got to have special precautions for these people. And because the problem is the muscle is weak, myogenic, probably it's going to require a more aggressive surgical procedure like a frontalis sling, and that could be even done primarily rather than our usual surgical procedures for mild ptosis because we know it's going to progress. It's a genetic disorder, and so you can test it now. And the gene is a polyadenylate, which is a poly A, which means too much of that, and that's going to be a triplet disease. Binding protein in the nuclear 1 gene. So it's a binding protein that causes the poly A to cause a problem with muscles, a myopathic deposition into those muscles of poly A product, which is too much of a good thing. And there is a founder effect because there are specific populations that have been affected. And when those populations come to a small geographically isolated places, or the people are all intermarrying, that means there's going to be amplification of a genetic disorder because it's going to stay within this small population and persist. And so that founder effect is seen in French Canadians who, in my part of the country, came down to Louisiana and are called Cajuns, as well as New Mexico Hispanics and Ashkenazi Jewish people who tend to have consanguinity in their marital relationships. But there's no cure, but the treatments are supportive. And for an ophthalmologist, thing we got to worry about is make sure that ptosis doesn't cause exposure if we treat it, and to recognize that the ophthalmoplegia is bilateral, usually symmetric, progressive, and slow. You do need to work it up for other etiologies like myasthenia gravis, thyroid disease, and the genetic tests will establish a diagnosis. They're going to need genetic counseling in that case because it's autosomal dominant.